Good afternoon, friends. Myself, Dr. Lakshmikant Mishra, the Senior Consultant Plastic and Cosmetic Surgery, Apollo Hospital, and Director of Saundarya Cosmetic Surgery, Ruchika Market, Bhubaneswar. I have started this clinic in 2014 with a very good mind and for the society. Today's topic we will discuss on gynecomastia. What is gynecomastia and what is its cause, what are the classifications and why, what is its treatment. So gynecomastia, mostly we know it's a male breast, like male boob. Mostly it is noticed in the adolescent phase, adult, and most very rarely in the old age phase. The male breast is very offensive. The young boys are not happy with this type of chest, so they visit me and consult me for the treatment of this surgery. Next we will come what are the classification of this gynecomastia, what are the types of classification. We have a Simon's classifications, three type of classification: grade 1, grade 2 and grade 3. Grade 2A, 2A and 2B. Grade 1 where the almost this very small enlargement of this breast tissue. Grade 2A is my small to moderate enlargement with nipple size is also very normal. There is no laxity of this nipple. Grade 2B, here we will get it this moderate enlargement of the breast, and also there is laxity of the nipple, where you will see this hanging of this nipple areola complex. Grade 3 is just like a female breast, where excess enlargement of the breast tissue and also the skin laxity we can notice. The nipple areola complex is also laxed. So here the surgical indication is different. In the three categories, these indications are totally different. Now we will come why these things are happening in this person, this human being, this male persons. Mostly it is a physiological. Commonly we will see when the child becomes adult means adolescent to adult. During that there is a change of the fluctuation of the hormone. This the hormones in the body becomes testosterone, the male hormones. During that time we will get it also, there is a physiological gynecomastia, but it subsides during the period of at the age of 16 years. So there is no surgical indication, there is no medicinal treatment. We usually don't prescribe for this baby, for the children at the age of around 12 to 16 years. But if it is really cumbersome and he is not happy with this chest and he is not happy with this society, not adjustable with his friends, in that conditions usually we do this hormonal test, and if it is some deranged, then we send the patient to this endocrinologist for the treatment. Mostly anti-estrogens are suggesting, tamoxifen, but if it is not responding, then the only treatment is the surgery. The surgery is three types. One is liposuction, second is excision of these tissues, third is both combination of the liposuction and also surgical excision. Mostly I do both the procedures under local anesthesia, and most of the patients are in the middle age group and middle class society to my clinic, and I do these procedures mostly under local anesthesia. It's a tumescent method, and I inject around 250 to 300 cc's of this tumescent fluid. It's a combination of normal saline, adrenaline, ropivacaine and xylocaine. It's a local anesthesia. Within 5 to 10 minutes the area becomes anesthetized, and I do liposuctions of the chest wall on both the sides, and the procedure will take around 25 to 30 minutes. Then I do immediately this surgery along with this one. An incision I placed on this inferior periolar region, and through that incisions the gland tissues are excised. Actually gland tissues requires excisions, as the glands cannot be removed by liposuction procedure alone, and if you will do only liposuctions and without excising this gland tissue, then the shape cannot be maintained very well. Here the only indications is the most of the conditions I have seen, both these procedures is helpful. Otherwise this surgery is not complete. So most of these procedures, both combinations of both the breast, this liposuction and the excision of the glandular tissues, takes me 2.5 hours to 3 hours maximum. And I put drain on both the sides in all my patients to prevent any other complications like hematoma and also any collections of this chest wall. I remove this chest drain after 24 hours of this surgery. The few complications of this gynecomastia which I notice is the bleeding. In my series 2 to 3 cases, more than 500 cases, 3 cases I have noticed bleeding, hematoma, and where I have re-exposed this chest wall and ligated this and cauterized this bleeding point. And second one, infections very rarely I have noticed, and 3 to 4 patients there is altered sensations of the nipple, but within the years these nipple sensations returned back. These are the few complications I have noticed, and I suggest my patients to use pressure garment minimum of 6 months and massage to be started after 3 weeks of the surgery. Thanks viewers, and subscribe my channel.